neurologist says that from the treatments, I can't remember if it's the lighter area or the darker area of gray is because of those shock treatments of the brain.
You've got pieces and parts of things in there that I'm not sure about. Now, there is white matter and gray matter of the brain,
right,
and that's normal. I mean, all of us have that, the gray matter and the white matter. So ECT doesn't give you more or less of that. Stroke might. I mean, of course, a stroke is where
he's got two different neurologists, so one from the shock treatments and one from the stroke is what's caused the bigger difference or whatever.
Okay.
If you don't really...
No, ECT doesn't cause brain cell loss. It doesn't kill nerve cells. As a matter of fact, remember me talking about antidepressants and how they make you grow new nerve cells? ECT does the same thing except more. So ECT, studies have shown that it causes you to grow new nerve cells. And what it is like having a seizure, really. It's exactly like having a seizure disorder. And everybody gets scared about seizures, but really seizures are in and of themselves, the electrical activity that happens in a seizure in the brain is not dangerous. What's dangerous is if you stop breathing and you don't wake up because you choke to death, or you stop breathing during the seizure. So the seizure itself doesn't damage the brain, and for the ECT, it doesn't damage the brain. So I would disagree with the one neurologist. I would say that the other neurologist is more on the money if he says it's not affecting the brain, not affecting, damaging the brain. It's definitely affecting the brain. Did that answer that?
Yeah.
I think I tried to.
I got it out there, right? Yeah.
Okay. Yeah, another question.
I have a friend that suffered with depression, and nothing was working. And
yes.
She had ECT about 4 years ago. And after the ECT treatment, the depression was better, but her memory.
Okay.
A terrible memory problem.
Okay.
And now, just recently, she was diagnosed with Alzheimer's.
Okay. And you're wondering, so the question is, a person who, and how old was the person?
She was 64.
64-year-old lady who had no signs of Alzheimer's disease that you know of, okay, but got depressed, got severely depressed, so much so that medicines didn't work, and then the physician did ECT, treated the depression, but the person never recovered, and their memory kind of slipped, and they ended up having Alzheimer's disease. Let's talk first about memory and ECT, okay? When you have the ECT, there is a short-term, there's definitely a memory loss around the time of the treatments, okay? Part of that's because of the anesthesia, and you have little black spots where the anesthesia was given. But the other part of that is probably related to the treatments and to the depression and everything all wrapped up in one. Those 2 weeks or so may be a kind of a blank for that person. But studies have shown that it does not interfere with long-term memory, and it does not interfere with your ability to learn new things going forward. So my guess is, remember me talking about how Alzheimer's disease, sometimes you'll have depression before you even know you have Alzheimer's disease? Why? I mean, we think the reason is because the nerve cell loss or the damage that's going on in the brain as part of the Alzheimer's process is actually causing the depression. And so then you see the depression, you don't really see the memory stuff yet. All you see is the depression. You treat the depression the best you can, and then you start to see the memory stuff as the time goes on. So like you said, after 4 years or so. So it's not like I would imagine she didn't have the treatments and then she was had severe Alzheimer's right away.
No.
Right? She probably gradually slipped into the Alzheimer's thing later on. But I understand. I mean, a lot of folks would fear that. They would say, oh man, that's got to be the ECT treatments. Probably not. We've studied that a lot because there's a lot of fear about memory with ECT. So, matter of fact, I've had patients. One of the greatest cases I can say I had was a gentleman who came to me. He was 81 years old and had just got through battling cancer, and was psychotically depressed. He was actually convinced that he was given cancer by God as a punishment. And of course, no matter how much you try to explain to him, I don't think so. I mean, the God I know wouldn't do that to somebody, So, but reasoning didn't work, and medicines didn't work. I kept trying to give him medicines he wasn't eating. He was probably going to die if I didn't do something quick. So I referred him for ECT, and his daughter came back, and it was several weeks later. His daughter came back and said, "I just want to thank you. You saved my dad's life and brought him back to his normal self." And sure enough, He was able to carry on a conversation. He looked like he had Alzheimer's disease as part of his depression. But when we treated his depression, his memory was fine. And I saw him for 4 years before I left practice, and he was doing fine. He was walking a couple miles a day. He was taking his medicine. He was not depressed, and his memory was fine. So ECT doesn't cause Alzheimer's disease, obviously. I mean, how many people have Alzheimer's and how many people have ECT? Not too many people get ECT, but there's an awful lot of folks with Alzheimer's. Yeah?
I just wondered, like, if you suffered with depression for years and you've been on medication after medication, at some point in time, what happens? Do the medications finally wear out?
Oh, that's a great question.
And you have to have ECT? I mean...
That's a great question. And the longer somebody struggles with depression, the harder it is to treat it, the harder it is to get it better. And I don't know why that is. I think when we think of some of these illnesses, that happens with a lot of these things. So like the longer somebody's manic, the harder it is to get them out of it. The longer somebody's psychotic with schizophrenia, the harder it is to get them treated and get out of it. Why? I don't know exactly why. In the brain, I guess I don't know exactly why. I can't give you some physiologic answer for that. I would say that my advice to you is that if you know somebody who's had that happen, where they have severe depression that goes on for years, and they try medicine after medicine, and nothing seems to help, there are a lot of kind of fringe or sort of experimental or research type treatments that we're doing that are not like inhumane type things, but different things that you can try. ECT is one. But there are different things, and you probably at that point would want to see a specialist in a like an IU or even somewhere else like Mayo or something like that. And I'm talking about a specialist for psychiatry. There are a lot of stuff. I mean, they're using magnetic stimulation to try to avoid using electrical stimulation instead of ECT. It's called transcranial magnetic stimulation. So person's awake, put the magnet on their head and send a magnetic pulse in, and that treats the depression. At this point, it doesn't look like it's no more effective than ECT. Probably not as effective as ECT, but someday maybe they'll get there, and that's a lot easier to do. You don't have to do anesthesia and all that stuff. So there are a lot of different types of treatments. The other thing I would make sure about is that the person, number one, took their medicines as the doctor recommended, because a lot of folks will take it and then it doesn't work in a couple of days. I'm not taking this junk, it's not going to work. The other thing is a lot of doctors don't necessarily follow the person close enough and make sure that the dose is right on the medicine. So if you don't have the right dose, you might improve temporarily and then sink right back into depression. And that's probably worse than getting no treatment at all, because the person's getting it's in the brain. That's probably worse. So make sure that those things are. That you look into those things, I would say. Anybody want to know about alternative treatments? St. John's wort, omega-3 fatty acids, fish oil, SAMe, have you heard of those things? The long and short of it is, I think St. John's wort, it works for mild depression, but it doesn't work as well as the antidepressants for the more moderate to severe depression. There was a recent study by, I think it was the NIMH, National Institute of Mental Health, showing that. So I probably wouldn't recommend that one. The other reason is because it interacts with a lot of other medicines, especially transplant medicines that folks use for transplants and different things. Omega-3 fatty acids, on the other hand, fish oil, it sounds funny. Okay, I'll grant you, it sounds funny. Taking fish oil? What you talking about, Doc? A lot of cardiologists use that for cardiovascular health, but I think what's good for the heart is good for the brain. And actually, the studies have shown that it helps IQ in kids in the developing brain. So just recently, if you notice, they're starting to put these, it's DHA is one of them, and they're starting to put those in infant formula now. Europeans have been doing it for a long time. Why didn't we get on the ball? I don't know. But they studied the kids that got formula with DHA in it in Europe versus the kids here that didn't get the DHA in their formula. IQs were a little higher over there. So we got to start thinking about some of these things. And even though they seem kind of alternative and everything else, I mean, it's the oil from a fish. You eat salmon, you're probably going to get some of this stuff. But you can take capsules as well, and there's probably less likelihood of mercury from the capsules than there is from the actual fish. Those are fairly safe. I don't know of any side effects from those other than just having to take them and that kind of stuff. Fairly inexpensive as well, probably cheaper than antidepressants. The problem is we don't know how much to give. So one of the studies was with 9,000 milligrams, which is 9 capsules. Well, okay, but that's a lot to take, right? These are kind of big, you know. And but I don't know. I mean, nobody knows if 200 or 500 or, you know, I don't know. I mean, I would say try a couple a day and see if it makes a difference. It incidentally would work sort of like antidepressants. It wouldn't be an immediate thing. None of these things will be immediate. Even the St. John's wort. It'll take a while to work.
SAMe, what is that?
SAMe is another one. And actually the studies on that one have shown that it's equally effective to antidepressants in high doses. A lot of times when people want to take something over the counter, it stands for S-adenylmethionine or something like that. It's a big chemical name, and it's also something that the brain needs to work the way it should. And sometimes we get it out of our diets, and sometimes not. Depending on, you know, like the fish thing's the same thing. People who eat a lot of fish don't have as much depression and things. So part of it's where we live, and we just don't eat much fish in the Midwest. We eat steaks, you know. There's no DHA in steaks, you know. And SAMe, the problem with it is that you need high doses of it, and it's just as expensive as antidepressants by the time you get the over-the-counter dose that would work for you. But side effect-wise, I mean, if you're having trouble, you could always ask your doctor. A lot of times the doc will just say, "What? SAMe? What's that?" You know, doctors, I hear about this stuff through patients, and then I go look it up. That's how I know about it. I mean, you guys are better than me at searching the internet and finding all this stuff out, you know. Somehow, you know, I guess there's more of you. Maybe that's what it is. But, yeah, personal opinion is SAMe is probably okay, but any of these things, you probably ought to tell your doctor you're taking them, because there's no telling. I mean, nobody knows if, like St. John's wort had a lot of studies with it. That's how we know it interacts with other medicines. SAMe, we don't know. Probably fish oil, I don't know how that would interact with the medicine, but...
I think it's 6 and 8 for 3 years or more, and I don't know other than burping fish.
Of the fish oil? Yeah. Well, that's the only side effect I know
I've never
of.
had any side effects from it.
Yeah, and I don't think there would be any side effects from it. It's bad. It's like eating salmon. I mean, it's really the same thing. So, and a lot of folks are on at least 1,000 from a cardiologist. I have a lot of patients that have heart disease that are on the fish oil, and I find out about it, and I say, hey, you know, you're also having depression. Why don't we up that a little bit? Your cardiologist would probably be pleased, you know. So I don't think you can go wrong with that. I mean, I don't want to tell everybody to go out and start taking fish oil or anything, but, you know, certainly worth a shot, I suppose. I mean, if you can't afford Prozac or some other medicine, you know. But the other thing is, don't ever do that if you're having, you know, severe depression. You know, you definitely got to have to see the physician to make sure you're not missing a thyroid problem or some other problem. You know. Okay. Any other questions? Guys, we're doing pretty good. Only one guy fell asleep out there, I saw. It's pretty hot in this room, I'll tell you. So thanks very much. Next month, I guess we're going to talk about dementia. Does that sound all right to you guys? It'll be about Alzheimer's, and then there's also other kinds of dementia besides Alzheimer's, so I'll talk about those too. There's, you know, Parkinson's and Lewy body disease and vascular dementia and different things. So we'll talk about all that then. Thanks for coming, everybody.